Periodically, a staff survey is performed to understand satisfaction. And this survey is performed across all Mayo Clinic sites. And the results are broken down amongst gender and various demographics of our staff. When we looked at the physician results, there was a disparity in how women physicians perceive their experience at Mayo Clinic in comparison to their male colleagues. And because this disparity seemed to be widening over the years, a gender disparities task force was formed at our institution. And so what you'll read more about in our manuscript is the work of the gender disparities task force and how we begun to implement some change in order to increase satisfaction amongst women physicians. My name is Dr. Alex Porter. I'm an associate professor of neurology. Our article, A Journey Towards Gender Equity in Medicine, will be published in the May 2023 edition of Mayo Clinic Proceedings. The first initiative was to conduct listening sessions. These took place over a period of about 9 months, where we were able to hear from cohorts of women physicians and scientists. And we had a scribe at each of these meetings, and we had some standard questions that we posed of each group. Based on the response, we were able to identify 4 themes with which we based our work for the Gender Disparities Task Force. The first was that women physicians and scientists wanted to have clear understanding of what was required for academic promotion and advancement. The second is that our organization is a complex matrix, and our women physicians and scientists felt that they needed transparent tools to help understand how to navigate it. There were lots of innuendos or a sense of a sort of a hidden curriculum, if you will, that we needed to do some work on to help make much more transparent. The third is that we learned there were some areas where gender bias was taking place within the workplace. And some of what we heard were microaggressions between allied health staff and women physicians. And that was something that we needed to be able to address. And then fourth, not all women physicians and scientists were as interested in academic advancement, but certainly they wanted to learn about how to advance in their careers, how to start to engage in leadership, how to really develop a career that they felt joy in. And they were looking for us to create some information surrounding that sort of advancement. And so there were a few things that we did in order to meet the 4 themes that were raised through the listening sessions. The first was that we did a CV review of all of the women physicians and scientists who had been here after a certain period of time, and we excluded those who had already reached full professor. And we gave them some feedback and also in some cases reached out to their chairs and encouraged them to talk about what the next steps could look like. And we also had some seminars and sessions with members from the promotions committee so that these women physicians and scientists could have their questions answered about what was being looked for at each level. In terms of being able to navigate a complex matrix, in our effort to help women physicians and scientists navigate our complex matrix organization, we invited leaders, past and present, to share time with us over the noon hour by Zoom. And it was a session that was recorded, and so people could refer back to it later if they weren't able to attend, to really have some understanding of what it takes to be a leader here. How do you handle some difficult conversations? Maybe if they're taking place with your chair, or even sometimes with a colleague. How do you give feedback? So these are some of the things that in our complicated matrix, it was nice to really make tangible for women physicians and scientists. And some of the sessions spurred so much conversation that they led to sub-sessions, which was also really valuable. In terms of gender bias in the workplace, we performed a survey looking at both men and women physicians and their experiences with allied health staff. And we did find some things that weren't surprising here, that it's more often that a woman physician may be called by first name compared to her male counterpart. And that there might be a questioning of an order or something like that by the allied health physician by an allied health staff toward a woman physician in comparison to the male physician. And so as we were able to pull this data from our practice. We were able to meet with nursing leadership and other allied health leaders to discuss how we might be able to mitigate some of these barriers that are occurring within the workplace. There are several interventions that are ongoing, but one of which that has been very helpful is the addition of a name plate underneath our badges that identifies who's who within the care team, so that patients are no longer confused about who the doctor is and who the nurse might be. And there's less of an impetus to refer to the female physician by a first name as opposed to their professional title. And so that's one example of one of the interventions. And then finally, in order to educate women and physician scientists on how best to advance their careers, not only did we get to hear from some of the wonderful folks in leadership development, but we also developed an intranet website, and we curated important links that people should refer back to frequently. We started a monthly newsletter or bi-monthly newsletter that went out, hey, did you know about XYZ? And so there are different opportunities that come up in our institution all the time, and we really wanted to make sure that the masses had some understanding, not just a select few. And so these are some of the things that you'll read more about in our article in Mayo Clinic Proceedings. I am appreciative that Mayo Clinic has taken a stance to really promote gender equity in medicine, because we recognize this is an ongoing problem. Even though we're 50 years past Title IX, we still have work to do to ensure that women physicians and scientists have an equitable experience in the healthcare workplace. And so the next steps in this research is to come back around and survey women physicians and scientists, perhaps even have more listening sessions to really have an understanding if the interventions that we have put into place during the time of our Gender Disparities Task Force have held. And so the easiest way to see if what we've done has made a difference is to look at the results of the next all staff survey. Thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.